In the Democratic Republic of Congo, a typical medical degree is 7 years long. It is largely theoretical. A majority of students finish their medical training having had no practical experience. At the completion of their degree, they return to rural villages and perform surgeries they have only ever seen in books.
I'm Dr. Samuel Asimu Mbabazi. I'm a Congolese and I was born at Nyakundi's village.
My name is Polisi Zawadi. I'm a medical doctor, a generalist.
After completing my study, I came back from Kinshasa to my village at Bunia. In our teaching, we had many theory, but we can finish study without doing some practice.
We were taught about it theoretically, just reading in books, but we've never taught how to do it practically.
Due to a lack of training, even a relatively simple surgery like a caesarean section can result in further complications or even death. This woman is smiling after her treatment, but it was not always the case. She had a caesarean section in a rural medical centre and her ureter, the pipe between the kidney and the bladder, was damaged and sutured to her vagina, resulting in her constantly leaking urine. This type of injury caused by untrained doctors has an enormous effect on a woman's physical, emotional and social well-being.
No, we didn't have training in C-section. We are just doing it as we can because it's an emergency, so we are just trying to save life as we can. It was not easy to do the first C-section because I was worried because we are just learning theory in books. We never saw it, so I was worrying about what I will find there. It took long time, more than 2 hours for one C-section.
When you are performed even if a C-section without having further knowledge according to how you can perform it, you will have the bad outcome.
Here, when somebody finish his medical study, he's just doing what he can do. But we are just looking for somewhere where there is a senior who can teach how to hold surgical instruments, how to do a C-section. In our country, we don't have enough opportunity to learn more.
AusHeal's main focus, however, is to provide training for clinical staff to improve their knowledge and, importantly, their practical treatment and care. Despite the hardships medical staff experience, there is a new generation of young doctors and nurses keen to provide better medical care for their patients. AusHeal needs your help to continue this training. Through generous funding of Gateway Baptist Church and other donors, including the Australian Government, AusHeal was able to construct a purpose-built training centre at Heal Africa Hospital during 2018. The training centre was opened in April 2019. Funds are needed to continue this training to allow those women and children living in poverty to receive appropriate care.
Today I'm very happy and I'm also very sad. Why I'm very sad? I'm very sad because when I started realizing what I was doing before starting my training, I realizing that I really did many bad management. I'm very happy today because I'm realizing according to my training, I'm not the same. Even if when I try to compare when I came from my village to start my training and what I am today, I realized that it is two people different, two doctors different, because I didn't know, but today I know it. I'm confident when I'm taking care of my patient, when I'm receiving my patient, and when I'm managing my patient. I'm very confident today.
I think I would like to work in the area where they are vulnerable, to be more, I don't know if the good word, useful. my nation, my neighbors, for the population, for those who are in need. I want to have more skills, to know more, so that I can be useful.